So welcome to the TRT and Hormone Optimization YouTube channel. And as a guest today, we have Tom and Sam from the Mojo Clinic in the UK. Welcome, guys.
Hi, thanks for having us.
It's a pleasure. So let's talk about the different TRT options in the UK, the pros and cons and the costs. So yeah, just go ahead.
Yeah, absolutely. So generally speaking, when men first notice the onset of low testosterone symptoms in the UK, their first point of call is with their National Health Service, NHS general practitioner. Unfortunately, especially if they're below the age of 40, a lot of men won't even get their testosterone levels treated or checked, I should say. If they do get their levels checked and it comes back low, most GPs will tell the men to wait 6 months and retest later down the line. And in the small proportion of men who are taken seriously, they often get referred to an NHS endocrinologist that usually has a 6 month to 1 year wait time. So just to even get to the point where you're being prescribed testosterone in the UK on the NHS is very time expensive. And generally speaking, after going through that very laborious process, the treatment options on the table within the NHS are typically very poor. So the two main options on the table, if you do go that route, are generally the low concentration 1 to 2% brand name alcohol-based gels, which a lot of people on your channel will be familiar with because you've done a lot of content essentially talking bad about them, and rightly so, they're ineffective. So things like Testogel, Androgel, Testim. The problem with these interventions is that they contain too little testosterone to actually raise serum testosterone levels in the blood to a point that produces symptom resolution. And because they also shut down a man's own production, it's very, very common for a man to actually have, when they check their levels at trough 24 hours after their last application, to have lower levels than they did before they started treatment because they've shut down their own production, but they haven't adequately replaced it, which obviously, generally speaking, does more harm than good. So that's the general experience with the gels. They don't work. The other option on the table within the NHS is testosterone undecanoate, or Nebido. So that is generally an injection every 12 weeks, usually 1,000 milligram. The reason this can be done so infrequently is because testosterone undecanoate has a very, very long half-life, about 30 days, which is the longest of all the different testosterone esters. Somewhat similar to the gels, again, is that the dose administered and the frequency at which it is given are too low. So it's very common for the weeks or even months leading up to the next injection, serum testosterone levels have already dropped to a point where a man is back in hypergonadal territory and the associated symptoms return. So because those two medications are prescribed on the NHS, they're not too expensive. There's about a £7 or £8 prescription charge. But the problem is the whole point of TRT is to improve your quality of life. And if neither of those medications do that, and there's a lot of resistance within the NHS about, doing the gels twice daily or moving to a more effective intervention that Sam will come on to soon, and or, any of the other options available within the UK, you're getting it for cheap essentially on the NHS, but it's not doing anything for your quality of life, and there's no actual way to change that. So that entire experience of either being rejected outright and or finally getting put on TRT, oftentimes a year later, just to be put on an ineffective intervention, is what leads men to the private sector and to clinics like ourselves, where we are not bound to the same poor treatment interventions, essentially, and there's a lot of more effective options on the table, which Sam will come on to now.
Okay. Sam.
Yeah, so if you do go private and you get a private prescription, Sustanon is well known. I know you've talked about it plenty of times. It's an injectable type preparation, and you actually can get it on the NHS. So there is a chance that could happen, but unfortunately, the way that it's utilised is it will be something like every 3 weeks. That we all know that it's just not going to give you those sort of sustained levels to feel better, sort of like the package leaflet instructions that you get. Really, like Sustanon, if you're utilizing it and you're getting it privately, it's best really sort of in the every other day, daily, sort of twice weekly for some sort of range, not sort of those sort of frequencies that they would use. In terms of like its pros privately, it's the cheapest option. It's the lowest cost option for injectables in the UK. So you know, £3.50 to sort of, you know, £4.50 usually from most pharmacies if you go in with a prescription. And you don't need like a specialist pharmacy with an import an import license or anything to get it. So, you know, it can actually be quite cost effective if you look at it that way, sort of like £10 to £15 a month for your medication. Even if you use that much, you know, that's usually guys using less. So even if you compare that to sort of, you know, the NHS sort of, you know, paying for your prescriptions actually can be comparable. So I suppose the cons that might come with it does contain a oil, which for some could be quite inflammatory. So I think, you know, it's been covered plenty of times where some guys get a bit more like post-injection pain or you know, they just don't really tolerate it very well. But there is also, you know, the fact that it can't be, you know, it's a struggle really to use it if you need to do it sub-Q. So, you know, that's one of the negatives there as well. I think one of the key things about Sustanon is there is a negative for it. It's got a bit of like a bad reputation. There's like stigma now associated with it. For a number of reasons, some active efforts by certain people to try and make it look bad, you know, because they want others to use other things. And then not being used in the right way, you know, so you using it sort of every 5 to 7 days. You know, we discussed this on Danny's video we did recently on how to use like Sustanon properly. So, you know, really like it's unfortunate, but that, you know, if you can understand that, then you can get around like the potential nocebo effect it can have, you know. So that's Sustanon, which is an injectable. So that's the most common. And then we have, you know, Enanthate. Everyone's sort of heard of Testosterone Enanthate, I would think, or most people have. But you know, just like Cypionate and Sustanon, the esters that bound to testosterone, their job is to prolong the release of the testosterone into the body. So it's depending on where you sort of read, it's sort of 4 to 7 days half-life. Obviously, there's, you know, between each person, there is always a difference. That's why you got to go through the process. But if you're looking for an Enanthate, and if you were just to walk in with a prescription to most like high street pharmacies, you know, you're going to be most likely met with the cost of like £100 to £150 for 3 ampules of, you know, 250 milligrams in a mil. And it's primarily because the distribution rights, I think they're owned by a single entity in the UK. It's happened a few times with like T3, like thyroid medication as well in the past. So they can just charge, you know, really, really high prices. But, you know, you can get it if you have a pharmacy that has an import license in the UK, and there are many of them. You can get it for about £6.60 an ampule. So again, you know, you're looking at if you're using sort of like 3 of those over the course of a month or something, it's quite cost effective in comparison. So the Cypionate is the next one. So it being interchangeable with Enanthate. Cypionate is something that the US, you probably noticed the majority of the you know, the social media, sort of the awareness, that the education does come from America, and it is the most commonly, you know, used and available one there. You know, most people would say, you know, it's if people get Enanthate or something different, they'd be like, oh, that's fancy. You know, I've managed to get something slightly more unusual. But because of that, I think a lot of people in the UK and Europe, you know, they're reading those things and they hear Cypionate being mentioned. They're like, okay, this is effective. So quite naturally, you want to sort of be drawn to that. But it is interchangeable with Enanthate. You know, in terms of like half-lives, it's, you know, there's always debate of like whether it's a 1 day or difference or similar. But again, it you know, having changed it personally, but also having seen it in practice, you know, it is interchangeable. The one thing about it in the UK though is because it isn't one of the licensed products. You know, you're looking at about £13.50 on average for like a 250 milligram. So whether that comes in like a multi-dose vial, like, and you add up the milligrams or single ampules, you know, most people that you know that are on Cypionate and know that they can get an Enanthate for a better price, like the £6.60, you know, or transfer, and are doing fine, doing exactly the same as they were before. So yeah, I think it's also one thing where whether it's a pro or con, but like, you know, Cypionate has also been made. There's been active efforts to be like, this is something really special. You know, like all the others are bad. You should be using this. When it's unfortunate because it just creates anxiety for patients if anyone's like that dogmatic about it. And yeah, I think that could be a negative for some, sort of as we you know, as we approach these different types. So I mean, so those are the injectables. There is also then compounded cream. So I know you use this, Stephen. Mm-hmm. So compounded is, you know, it's a word that you can hear in like American pharmacies as well, that they can actually use compounding pharmacies for injectables, so they can make like custom blends, or if you don't get on with arachis oil, you can have grapeseed oil, but it basically means you can make custom formulations of products. In the UK, we don't have that ability, you know, with injectables. So you hear compounded cream, which basically means that they can make a specific dose in a specific base. And then that creates the difference in efficacy between, you know, like Tom talks about the off the shelf gels and creams that you hear there. So you have I suppose the one thing about it is it can be about £30 roughly a month, sort of roughly across the board from the pharmacies, and then you have the fact that you have to apply it. So obviously you have to apply it to the scrotum. Well, you don't have to. Ideally, you know, better absorption. We know about potentially the more DHT that could be produced because of, you know, more of the presence of the 5-alpha reductase enzyme that converts it to DHT. But for some, applying it to the scrotum, you know, twice a day can be a pro because you don't have to inject, you know. But then for some, it can be, you know, compliance, is this tedious, you know, am I going to miss things, you know? And there's also the thought of, you know, transfer risk, you know, could you potentially transfer it to a loved one, or you know, or something like that. So yeah, that's just another consideration. The one thing about the absorbability of that cream though is also that if you have some differences, like there are variances in, you know, the injectables when people, you know, go through using them, the process is that you can have different sort of absorbability for people, and that can mean that you've got to go through the process, find out where you are on bloods. It might be you need to do like a different ratio of things, like 100 in the morning, or, you know, it's like 250 once in the morning, and then like a smaller dose later in the day. So that there can be not necessarily a challenge, it's just knowing what you're doing, going through the process to figure that out. That really, I suppose, covers the compounded cream in terms of its pros and cons. I think that's a good summary. I mean, we have is there anything else you guys can think of that for those that I've missed?
That was very clear, considering the methods of application. But what about the cost of going to a private? Because that's what I hear from people in the UK. Oh, if you don't go to the NHS, that will cost quite a bit.
That's typically because the way in which the vast majority of private clinics currently operate in the UK is that they own their own pharmacy, and they force patients to only have access to testosterone via their own pharmacies. They mark up the cost quite significantly, when in reality, if that patient was just given a private prescription by the clinic and was allowed to source their medication themselves direct from the pharmacy, which is how we operate, you cut out that middleman. You're not paying the clinic to import the meds. The clinic aren't then putting a markup on that and then selling it back to you. You're just going direct to the pharmacy, and that's how we operate. So it can be very expensive if you're with someone or a place that operates on like that, but that's not the case with ourselves. So with us, you're issued with a private prescription, and all the prices that we mentioned before, things like £15 a month for Sustanon, £15-20 a month for Enanthate, £30 a month for compounded cream. From a medication perspective, obviously you have things like blood work and follow-up doctors' consultations and things like that to consider too. But from a medication perspective, that's how much those things cost. So it's not actually that testosterone in the UK is expensive. It's just the way in which people currently existing in this space in the UK are overcharging, taking advantage of people essentially.
Okay, that's clear. So you guys are kind of the managers of the clinic. So you work together with doctors that are working for you.
Yep. Yeah, exactly. Yeah. Okay. So you get so your prescription. So we also not only give you your prescription if you want to go and find somewhere, but you know we've put in some work, and we would always help guys find. We've got pharmacies that we found, you know, that are independent, that we've got their price lists, and you know, if you want the doctor to send it directly to one that you choose because you've seen the prices and how much it's going to cost, they will deliver to you as well. So you still get that ability to have your medication delivered to you, but just from normal pharmacy prices. And if a pharmacy has to order in some stock, like pharmacies do because they've run out, you know, you've got the ability to potentially shift to another one or go and find it elsewhere. So, you know, you're not trapped with dealing with one pharmacy that might have a certain issue with sort of bringing medication in as well. Yeah.
And just to really hammer home that fact that, me and Sam, we're there to support patients. We're there to talk about them in a kind of general, non-specific manner. Me and Sam have both been on TRT for well over 5 years now. You know, we both have degrees in the healthcare sector, but we're not doctors. We'd never give direct medical advice. All direct medical advice, prescriptions, etc., are all done in consultations with our own doctors. So yeah, there's no
Great. Thank you for the nice overview. If people would want to contact you, how can they do that?
Yeah, so we have a new website's nearly there, but you can go on our temporary website. You've got all of our contact details. You can send a message through there. You can reach out to us either by phone, that's on the website, or, you know, our email. We've got a support email, support@themojoclinic.com. Website is www.themojoclinic.com. You know, we have a Facebook group. We'll be changing that to a bit more of a forum setting soon, but feel free to reach out to us in that way. And we're happy to help. And we do offer, you know, just free informative calls. You know, we want to make sure guys know, you know, what the process would be if they're coming through and what it means, and we'll send them away with resources. And just starting the journey, sort of feeling informed is really important. So there's no stupid questions. If you just want to reach out and ask something, you know, there's no obligation to sort of come through the process.
Awesome. Thank you, guys. I will leave the links to your clinic in the description of this video. Thanks.
Great. Thanks very much.